Facebook and elsewhere. They asked me to do a 4-step series. So if you're interested, we can give you more information about that. It's diagnosed earlier, it's harder to treat, it's more aggressive, and they tend, and I keep on saying this. I'm going to say a quick note. What they found out is that the worst kind of breast cancer, Black women tend to have it twice as much, or they're more likely to have it twice as much than white women do. And it's a very difficult cancer to treat because they can't really find any specific targets. There's a lot of talk about how to treat it, but they haven't come to any conclusion, and it tends to recur. So here's the big question. Why are Blacks worse off? Here are some of the things they're finding out. Genes, we'll say a little bit about that. Big problem. And that could be related to our genes too, but it's also related to our lifestyle. We tend not to eat the right kind of foods. We tend not to exercise and put our health as a premium. Especially when it comes to Black women tend to prioritize the health of everybody else except their own. Take care of the whole family and their extended family and blah, 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 blah. I've mentioned diets, less activity. Of course, if you have me on any show, I will talk about vitamin D because that is a common denominator, no matter the condition we're talking about. Let's say a little bit about genes. So, like I said, we tend to have high obesity. We don't know what exactly it is in the genes. There are some mutations that seem to be more common, called the BRCA1 mutation, seem to be more common among Black women than in white women, which predisposes them to cancer. Obesity, we can't do much about genes. So let's focus on the lifestyle and the things we can focus on. The obesity increases the risk of breast cancer fourfold. That is what they are finding out.